Hi, I'm Dr. Nitin Singhal. I'm working here as a consultant surgical oncologist. I'm associated with Apollo CBCC for now almost 4 years, and I'm in this field of surgical oncology now for almost a decade. And I mainly specialize in all advanced GI, gynec, and uro cancer surgeries, and advanced surgeries like HIPEC and minimal invasive, that is in common man's language, laparoscopic cancer surgeries. So, dealing with difficult medical situation, I believe that is a part of the training that we receive, and as we evolve, obviously we keep on learning. So, as you said, yes, obviously, nobody, as a doctor, I cannot feel completely detached that if my patient is not doing well, obviously it is bound to affect me, and that obviously affect my family also. But again, I would divide it into two phases. In the early phase of my life, and as I have progressed in my career. In early phases, yes, I used to get more perturbed with all the situations. I used to be more apprehensive about it. But now, as I have gained experience and I have been dealing them quite regularly, although we do have that sort of apprehension, but that does not, I believe, is actually transmitted onto others, and we can do it in a more controlled manner. So yes, it does drain you out at times emotionally and physically also, but as you grow, you can control your emotions in a much better manner, and you can do the things. So yeah, it feels good, and as you know, as you would agree, for every professional, excelling in their profession is the ultimate goal for everybody. And I will give you a simple example, like say cricket, which is a very, I would say, popular sport in our country. And if you remember the last victory, like World Cup victory or even the famous Gaba test, everybody was in a aura about it. Oh, well, we did so well. So if you take an example of that, I can basically say the same sort of feeling is what I feel when I see my patients doing well, especially when you know the cancer is a disease which does not affect only a patient. It basically affects the family also, not only financially, socially, as well as emotionally. So if some patient does good, then obviously not only that patient feels good about it, the entire family is basically salvaged out of that problem. And when over the years on the follow-up, when they come back and they tell you, oh my God, we are doing good, and thanks to the services and all, obviously it motivates you, it puts a purpose in your life to excel more in your career and to try to give even more than your best for all the other patients in the future. First of this case would be the gentleman. He was 68, 69-year-old. This was a case which was prior to my association with this hospital, and that patient was a case of CA, that is a lower anal canal, lower rectal cancers near that stool pipe. And this patient had initially received radiation and chemotherapy. Post radiation chemotherapy, unfortunately, the disease did not resolve, and the patient presented in a very messy condition that the tumor actually fungated out onto his skin and even invaded his urinary pipe, so that his urine also had feces in it. So you can imagine a condition of a 68, 69-year-old guy with full of feces lying on bed. And obviously for family also it's a trauma, seeing a patient like this. So, and when this patient came to me with other challenges, he had comorbidities, it was almost like an impossible case to start with. Technically it was still operable, so we discussed that with the patient, and the relatives told them about the whatever problems that one can expect along with the risks involved. They went ahead with the surgery. Thankfully the surgery went well, but unfortunately the post-op period, as we were expecting, was not as smooth, and this patient required a prolonged hospitalization and a ICU stay also. But thankfully, during that ICU stay, when many did not give him chance, somewhere I had this belief that he will improve, and he proved my belief right, and he did good. And now he's almost 5 years now post his surgery, and is doing absolutely fine. In fact, he recently wished me on my birthday. So that made actually my day, because the person remembering you after all these years and is still doing good. So that is one special, I would say, experience. Other than that, I would mention two other extremes of age cases. One was a girl which we operated few months back, a 3-year-old girl, and she had a very big tumor which was filling her entire belly, so big that she was finding it even difficult to breathe also. And normally we would have treated her in a different manner, but just because of the sheer mass and the problems that the patient was facing, we had to taken her for a semi-emergency surgery. And it was a very difficult surgery where we could have lost the baby. And as a person, I have been always like when I was had to choose a career between pediatrics and surgery. The reason I did not take pediatrics was when it comes to child, obviously everybody feels nervous. And deep within, I was feeling, okay, if something goes wrong with this child, I would not be able to pardon myself. Luckily for that patient, that surgery went well, and incidentally, then we later on came to know that the tumor was actually the biggest ever tumor removed. For that, it's a world record sort of a thing for that sort of a girl. And now, with God's grace, that child is doing extremely good. Recently, on our follow-up scan, the disease is absolutely under control. So obviously, that gives you an immense pleasure that you could give back the child to their parents, and the child is now going to live longer because the cancer is said that once it is removed completely, she is going to have a good long-term life. And the third case which I would share would be again a challenging case, but again another extreme of ages. This patient was gentleman was in 80s, and this gentleman had a cancer of the foot pipe. Foot pipe cancers are one of the challenging surgeries to be done. More so if the patient has previously received a complete course of radiation and chemotherapy, which in our medical terms we call it as salvage esophagectomy for a recurrent cancer. For younger patients also, it's a very difficult surgery and has a very high complication and mortality rates. But for an 80-year-old guy, obviously nobody would feel comfortable doing this sort of a case, and so was I also. But it is the patient's I would say confidence and comfort on me that he pushed me. Yeah, I'll be fine. You don't worry, I'll be fine. You go ahead with the surgery. Rather, he pushed me for the surgery, and by God's grace and his belief, again his belief was proven right, and the patient recovered uneventfully and is absolutely fine now. So these are the few life, I would say, mindset-changing experiences which I had in my life, wherein I got some messages on the first case, never say die attitude sort of a thing, and then again the belief in God in the other two cases strengthened over a period of time.